Ladies and gentlemen, today we have Dr. Amir Ali with us, all the way from UK, England, United Kingdom. So, Dr. Amir Ali is a consultant physician. He's associated with the Nottingham University Hospitals NHS Trust. Dr. Amir Ali is a geriatric consultant with interest in dementia and end of life care. Sir, we'd really like to thank you for joining us, for collaborating with us, and helping our audience understand more about dementia. We have some questions that each of us as team members are going to ask you. And if you allow us, can we start the question answer session?
Of course. Thank you for giving me the opportunity to present something which is very close to my heart. And I always feel that the care of patients with dementia in Pakistan needs to be improved. I would like to share that there is a lot of work being done from Aga Khan University and a few societies. However, there is a need to improve the education and awareness of dementia among general people in Pakistan.
Absolutely, sir. That was very well said, and definitely, there's a lot that needs to be, discussed. There's a lot that needs to be addressed, especially in Pakistan, because we have so many families here struggling with dementia. But again, the right guidance that we need, the right knowledge that we need, still, that is very limited. So we're very lucky to have you with us today, and we're very hopeful that after today's session, many of our viewers will be able to understand about dementia and have their very general and typical questions answered. So, sir, the very first question that most of us have, and I'm very sure that the audience who's watching us probably would be confused and would want to know, what is dementia?
So. Dementia is challenging to define dementia. For me to tell common people, but I can share my screen, and if I show you, these are the problems of dementia that in common language, dementia is memory loss. So people start forgetting things and it presents in a gradual way, and you find it difficult to differentiate between normal aging and somebody like me forgetting to turn the lights off or something like that, to a gradual memory loss. And it is not just memory, it is other mental functions. So if we want to explain what is dementia, you need to understand what is the brain. And brain has many mental functions. It has communication, recognition of objects, purposeful action, decision making, planning. So if I go to my slide and just explain to people first what is the brain. Can you all see these pictures? So the picture where my marker is at the moment, that is the main part of the brain. This is the central cortex. It is two hemispheres, right and left, and different parts of hemisphere control different functions. And this is the brain which Allah Ta'ala has given humans the power to think, the power to control actions, and it's there. Underneath this, in the second picture, is called cerebellum. The cerebellum controls the finer movements. It controls balance and activity, and these are also part of the brain. And then the third picture shows the brainstem. The brainstem is what controls our heartbeat, what controls our normal breathing, what controls our function of bowel and bladder. So these things are happening without our knowledge, but it is always happening. So brain, mashallah, is a miracle in itself, and it is more powerful than most supercomputers in the world at the moment. If you think of brain as which controls different parts of the brain. The picture, again, the first picture that I'm showing, this is part which controls my hand movement or my leg movement or my eyes or my mouth. This is the part of the brain which controls that. The second picture shows the part of the brain which is controlling my eyesight. So the way I process my vision. And then the third picture is about where my personality lies and people's personality, and where character sits, and where how I conduct myself day to day. And the fourth image, the middle part of the brain that is showing, is where my actions and thoughts and processes are. Most of the processing that I do, how do I plan something? This is the planning part of the brain. So if you understand that different parts of the brain has different functions, then it will start becoming clearer how dementia works. I also want to show you this slide because the picture on the left again shows the major blood vessels. So if somebody has a stroke and they block this vessel, front part of the brain gets blocked, and the part of the brain which controls the personality and everything, that will get affected. But if it is a block in the middle part of the brain, the middle cerebral artery, then they have weakness on one side, the side which gets affected, and so they have like a stroke. And if the posterior part is affected, then it is vision, etc. But other than this large blood vessel system, there is a tiny blood vessel system as well. And this system gets affected by atherosclerosis. This is the process which is happening when you have a heart attack or you're having problems with your kidneys, chronic kidney disease. And it's the same process, and it's happening slowly across all the little blood vessels, and they are furring up with all the niharis and halims and everything else that we are eating. So you can now see that how the brain function can be affected. And to bring it back to dementia, and these are pictures from Alzheimer's disease. The left side shows mild impairment or mild Alzheimer's disease. And you can see the blue parts of it are those parts which were the thinking parts of the brain. But as the disease progresses, different other areas start getting affected. And in severe disease, almost all of the brain is affected. So this is a very visual representation of dementia and how it affects all parts of the brain. So in plain English again, dementia is memory loss with functional loss of other systems in the brain. It is typically lasting more than 6 months, and it is gradually getting worse with time. And it starts interfering with the daily activities of life. And it is really heartbreaking and frustrating for carers and for the person themselves. It is not because of something else. So there is something that we have to, as part of my role or as a psychiatrist or as a dementia specialist, we concentrate on what could be it other than dementia. So we try and rule out other things before we come to that. Does that answer your question?
Perfectly, sir. You've shared some great details. We got to see some visual representation that maybe most of us would have never thought of. So the way you explained how it progresses, I think that was an excellent explanation. And thank you for answering this question in such detail.